Hello friends, today we are going to discuss here about very high yield topic. Let's begin. This is MCQs or MRCP part 1, a test series 5 MCQs. A 32-year-old diabetic man has chronic renal failure. Remember chronic renal failure. Has on peritoneal dialysis for few years. On peritoneal dialysis from last few years. He is currently on 1 alpha calcidiol replacement. His calcium is 3 millimoles per liter. Phosphate is 0.6. PTH is 9. What is your diagnosis? Guys, all options in front of you. Hypercalcemia secondary to vitamin D replacement. Primary hyperparathyroidism. Secondary hyperparathyroidism. Tertiary hyperparathyroidism or normal finding in dialysis patient. So guys, what happened in primary hyperparathyroidism? There is high calcium and high parathyroid hormone. Here not so. In secondary renal failure with high parathyroid but very low serum calcium. But what happened in tertiary? Normal calcium or normal parathyroid or sometimes high parathyroid. So here answer is tertiary hyperparathyroidism. This developed due to prolonged CRF. Tertiary hyperparathyroidism or secondary hyperparathyroidism occurs in renal failure because of hypocalcemia due to lack of 1 hydroxylation of 25 vitamin D. Tertiary hyperparathyroidism is due to long-standing secondary hyperparathyroidism. Despite vitamin D replacement to treat secondary hyperparathyroidism, the parathyroid gland continues to secrete lot of PTH. Treatment should therefore be removed parathyroid gland surgically in tertiary hyperparathyroidism. Now, 26-year-old man present with bitemporal hemianopia. Mention that the shoe size were above of his friend. Shoe size more. Since childhood, often sweaty episodes. Which of the following test is likely to confirm the diagnosis of acromegaly? Random growth hormone, IGF-1, glucose tolerance test with growth hormone suppression, Synestin test, MRI pituitary. So guys, what is single best answer here? Best answer is glucose tolerance test with growth hormone suppression. Let's discuss. In acromegaly, there is excess growth hormone which is difficult to suppress because growth hormone secretion is inhibited by glucose. Measurement of glucose non-suppressibility is useful. In the glucose tolerance test, baseline growth hormone levels are obtained prior to ingestion of 100 gram oral glucose. And additional growth hormone measurement are made of 30, 60, 90 and 120 minutes following the oral glucose load. Patients with active acromegaly are unable to suppress glucose concentration below 2 nanogram per ml. Random growth hormone measurement are often not diagnostic because of the episodic secretion of growth hormone, but IGF-1 has long half-life and useful as a screening of acromegaly. MRI may reveal a pituitary tumor, but it would not be specific for acromegaly. Hope all options are clear now. 35-year-old male initially present with cold hands. Complaints usually occurred on cold days or in cold water. Initially presenting pale and cold digits. Progress to painful purple fingertips. In the last 5 years, she complains of dysphagia and heartburn. The patient has a history of hypertension. On physical examination, her blood pressure is 150 by 90, heart rate is 90. Okay, skin hardness is there. Skin hardness and thickening were palpated at finger and toes. X-ray of bilateral hand and foot showed cutaneous calcification, especially near the fingertips. Which of the following test is likely to be correlated with the diagnosis? ANA, dsDNA, anti-centromere, anti-smooth muscle antibodies, or anti-U1 ribonucleoprotein? So guys, ANA, firstly you have to understand what is here diagnosis. This is a case of CREST syndrome, CREST, CREST. C for calcinosis here, R for Raynaud's phenomena, painful purple fingertips. E for esophagitis, so dysmotility and heartburn. S for scleroderma, so skin hardness, okay. And T for telangiectasia. So guys, how to diagnose CRASH syndrome? dsDNA is specific for SLE. Anti-ribonucleoprotein is specific for mixed connective tissue disorder, and ANA is specific for lot of autoimmune diseases, but not specifically for CRASH. C for CRASH, C for centromere, so answer is anti-centromere antibodies, whereas anti-CCP is for rheumatoid arthritis. So guys, here answer is anti-centromere antibodies. The limited cutaneous form of systemic scleroderma is often referred to as CRASH syndrome. CRASH is an acronym for the 5 main features like calcinosis, Raynaud syndrome, esophageal dysmotility, sclerodactyly, telangiectasia. The anti-centromere antibody is more specific for CRASH syndrome than diffuse progressive systemic scleroderma. Anti-U1 ribonucleoprotein is a marker for mixed connective tissue disease, which is characterized by presence of high titer of distinct autoantibody combination with clinical features commonly seen in SLE, scleroderma, polymyositis, referred to as overlap syndrome. Now, 2-year-old girl presented with 12-hour history of poor fever and poor feeding. Family on 2 cats. Her temperature 39.5, she is irritable, no localized sign of skin lesion, full septic screen was performed, cerebrospinal fluid showed neutrophilic pleocytosis, gram-negative cocobacilli. She was treated with cefotaxime and gentamicin. 24 hours, both CSF and blood culture showed gram-negative bacilli. What is likely infective organism? Legionella pneumoniae, Haemophilus influenza, Pasteurella multicoda, E. coli or Pseudomonas. So guys, Legionella, which one is answer? Answer is Pasteurella multicoda. Why? Let's see. Pasteurella multicoda is an oral commensal of domestic pets known to be an opportunistic human pathogen after traumatic animal contact. The most common infection in human are skin and pulmonary infection. Pasteurella meningitis occurs at extreme of age infants immunocompromised associated with liver cirrhosis, renal disease and hematological malignancies and after traumatic head injuries. So guys, hope till here it's very much clear. Now, the frequency of attendance of 100 medical students, remember. Lecture are recorded and observer over 3 month period. The student were then assessed at the end of multiple choice exam, test score out of 100. Which of these statistical method is best used to analyze effectiveness of frequency attendance on higher test score? Mann-Whitney test, Spoman correlation, chi-square, Fisher exact test, student t-test. So answer is Spoman correlation. Let's discuss. Spoman's correlation is the best method to determine 2 variables which do not follow a normal distribution. So guys, till here finish this test series, and if you like this video, put like on it. If somebody is new on my channel, please subscribe this channel. Thank you.